What if the leg weakness you're experiencing isn't just aging, but a fixable nutrient deficiency? After 60, your body absorbs vitamins differently. And 3 specific vitamins are so critical for leg muscle function that when they're low, your strength, balance, and independence start declining, often without you realizing why. Today I'm revealing which 3 vitamins research shows can support muscle repair, nerve communication, and blood flow to your legs. And the best part, you can start addressing this today, whether through food or simple supplementation. No gym required. Before we continue, drop a comment and tell me where you're watching from. And if you're experiencing leg weakness or stiffness, type yes, so we know how many people this is affecting. The reality of age-related muscle loss. Whether you're climbing stairs, getting out of a chair, or hoping to stay independent, leg strength is essential. What most people don't know is that legs typically show weakness first, making even simple tasks difficult, even if you're eating well otherwise. According to the American Geriatric Society, adults over 60 lose between 1 to 3% of their muscle mass every year. That's called sarcopenia, age-related muscle loss. It happens gradually, silently. No pain, no obvious swelling. Just a slow decline in strength until one day you realize how much you've lost. But here's what matters most. This isn't inevitable. Research shows that specific vitamins play critical roles in maintaining muscle mass, supporting nerve function, and improving circulation to your legs. When these vitamins are adequate, your body has what it needs to preserve strength. When they're deficient, decline accelerates. Today we'll explore 3 essential vitamins backed by research, how they work, and practical ways to add them to your routine. Vitamin number 1, vitamin D, the muscle repair powerhouse. Vitamin D isn't just for bones. It plays a critical role in muscle protein synthesis, helping you recover and maintain muscle fibers. Low vitamin D has been directly linked to reduced lower body strength and increased fall risk in older adults. Here's what happens. Vitamin D receptors exist in muscle tissue. When vitamin D binds to these receptors, it supports muscle cell growth and function. Without adequate vitamin D, muscles become weaker, and the risk of falls increases significantly. Research published in the Journal of the American Geriatric Society found that older adults with vitamin D deficiency had measurably weaker leg strength and higher fall rates compared to those with adequate levels. How to get it? Natural sources include sunlight exposure, about 15 to 20 minutes daily with arms and legs exposed. Fatty fish like salmon and mackerel. Egg yolks. Fortified dairy products. For supplementation, look for vitamin D3, also called cholecalciferol. The typical range for seniors is 800 to 2,000 IU daily, but your doctor should check your blood levels to determine your specific need. Quick tip: take vitamin D with a meal containing fat. Vitamin D is fat-soluble, meaning it needs dietary fat to absorb properly. Take it with eggs, avocado, or nuts for best absorption. Vitamin number 2, B12, for nerves and muscle activation. Vitamin B12 supports nerve conduction, helping your brain communicate with your muscles effectively. This is crucial because muscle weakness isn't always about the muscle itself. Sometimes it's about the nerve signals telling muscles to contract. Deficiency in B12 can lead to numbness, tingling, and weakness in the legs. This is especially common in seniors because stomach acid production decreases with age, and you need stomach acid to absorb B12 from food. Research shows that B12 deficiency affects up to 20% of adults over 60. Many don't realize they're deficient until symptoms appear. How to get it? Food sources include meat, particularly beef and liver. Fish like salmon and tuna. Dairy products. Fortified cereals and nutritional yeast. For supplementation, if you're over 60, you may need sublingual tablets that dissolve under your tongue, bypassing the stomach. Or your doctor might recommend B12 injections. Aim for at least 500 to 1,000 micrograms daily if supplementing. Bonus benefit: B12 also supports red blood cell production, helping deliver oxygen to working muscles. Better oxygen delivery means better muscle performance and less fatigue. If you're finding this helpful, please hit that like button and subscribe for more science-based senior health content. And share this with someone whose legs don't feel as strong as they used to. Vitamin number 3, vitamin E, for blood flow and endurance. Vitamin E is a powerful antioxidant that improves circulation and reduces oxidative stress in muscles. Better circulation means more oxygen and nutrients reach your legs, helping with endurance and recovery. Here's the mechanism. As we age, oxidative stress damages cells, including muscle cells. Antioxidants like vitamin E neutralize these damaging molecules, protecting muscle tissue. Vitamin E also supports blood vessel health, improving circulation to lower extremities. Research in the American Journal of Clinical Nutrition found that adequate vitamin E intake was associated with better physical function and reduced muscle weakness in older adults. How to get it? Food sources include almonds and other nuts, sunflower seeds, spinach and other leafy greens, avocados, olive oil. For supplementation, look for mixed tocopherols, not just alpha-tocopherol. Mixed tocopherols provide a broader spectrum of vitamin E forms. Around 100 to 200 IU daily is typically safe for most adults. Pro tip: combine vitamin E with vitamin C or CoQ10 to enhance antioxidant benefits. These nutrients work synergistically, meaning they're more effective together than alone. How to combine these vitamins for maximum effect? Here's how to stack them smartly for best absorption and results. Morning routine: take vitamin D with breakfast, ideally alongside healthy fats like eggs, avocado toast, or Greek yogurt with nuts. The fat helps absorption. Mid-morning: use B12, especially if you're taking sublingual form. If you have digestion issues, sublingual bypasses the stomach and absorbs directly through the mucous membranes under your tongue. Main meal: take vitamin E with your largest meal of the day. This aids absorption and reduces any potential stomach upset. Don't forget, hydration and light movement are critical. Drinking adequate water and doing light exercise like walking or using resistance bands help your body use these nutrients more efficiently. The vitamins provide the building blocks, but movement signals your body to use them. Realistic expectations: let me be clear about what to expect. These vitamins won't rebuild muscle overnight. Muscle tissue takes weeks to months to respond to improved nutrition. But many people notice subtle improvements within 2 to 4 weeks: less leg fatigue during daily activities, better balance, more confidence on stairs. Within 2 to 3 months of consistent use combined with light daily movement, you may notice measurable improvements in strength, endurance, and function. Your legs may feel more stable. Standing from a chair may feel easier. Walking may feel less tiring. This isn't magic. This is giving your body the specific nutrients it needs to maintain and rebuild muscle tissue, support nerve function, and improve circulation. Important safety notes: before starting any supplement, talk with your healthcare provider, especially if you're on medication. Vitamin D can interact with certain medications. B12 needs to be monitored if you have specific conditions. Vitamin E can affect blood clotting, so if you're on blood thinners, your doctor needs to know. Your doctor can also check your blood levels to see if you're actually deficient. Not everyone needs supplementation. Some people get adequate amounts from food. Testing tells you exactly where you stand. Stay strong, stay independent. You don't need extreme workouts or expensive equipment to support leg strength. By providing your body with the right nutrients, you're giving your muscles, nerves, and blood flow exactly what they need to function optimally. Remember, it's never too late to support your strength. Research shows that even adults in their 80s and 90s can benefit from proper nutrition combined with appropriate movement. Your legs have carried you for 60, 70, 80 plus years. They deserve the nutritional support they need to keep carrying you forward. Your challenge: here's what I want you to do. Pick one of these 3 vitamins to focus on this week. Check your current intake from food. See if you're getting enough. Talk to your doctor about testing your levels. Consider whether supplementation might help. Don't try to fix everything at once. Start with one vitamin. Get that right. Then add another. Small, consistent changes create lasting results. Which of these 3 vitamins surprised you most? Which one do you think you might be deficient in? Share in the comments below. Your experience helps others know they're not alone. If this video helped you, please hit that like button, subscribe to the channel, and share this with someone who needs stronger legs today. And drop a comment if you want a follow-up video on exercises or meal plans that complement these vitamins. Remember, aging doesn't have to mean getting weaker. With the right nutritional support and consistent daily movement, you can maintain strength, balance, and independence. The choice is yours. Take care, and I'll see you in the next video.